Our growing elderly and aging population is living longer and increasingly managing long-term or complex healthcare needs, placing greater demands on our health and social care systems. The requirement for the NHS to provide continuing healthcare services is growing. Meet Maud. She has end-stage dementia, unstable diabetes, infected pressure ulcers and anemia. She was admitted to hospital during the cold winter months following difficulties managing her diabetes, which made her seriously ill. After treatment and care, Maud's needs are no longer acute. She can be transferred to a nursing home placement with an appropriate recovery package in place. The clinical staff start the CHC assessment process to identify Maud's continued care and support requirements. The assessment processes are paper-based and carry a significant administrative overhead for Maud's clinical team. Papers must be accurately completed prior to the formal assessment process even being started. Despite best endeavours, gaps in information and inaccuracies are hard to spot, often buried within a paper submission. When they eventually come to light, the time and effort to rectify them inevitably leads to more work and delay. Maud's CHC assessment has been completed. However, gaps in information and the need for rework have meant that a decision in relation to CHC eligibility has been delayed for 2 months, increasing pressure on care facilities and Maud's clinical team. This inefficiency has caused considerable distress to Maud and her family. They had no visibility of progress. The assessments themselves were time-consuming. They had to tell her story many times over. Now, a software solution has been developed that drives simplification and streamlining across the continuing healthcare assessment processes. The system reduces the length of time that patients spend waiting for decisions and considerably reduces the admin burden for CHC staff. It incorporates electronic assessment templates and uses intelligent workflow to increase process efficiency and transparency. By ensuring checks are made early in the process, inaccuracies and missing data are prevented from entering the system. The system shows CHC managers the progress of each case and allows them to allocate them on a timely basis. The tablet-based system ensures that information is collected in a systematic, retrievable, and verifiable format. Cases are communicated to the multidisciplinary team, who then can easily view collated information to start the full assessment and DST recommendation processes. Being cloud-based, the system is scalable and can be deployed rapidly. Implementation requires little external resource, keeping costs low. Projected savings through process efficiency are significant in terms of staff time and cost of postage and printing. In addition, confidential information is stored in a safer way, communication is enhanced, and each patient's progress can be closely monitored. And as for Maud, by using the digital system, her NHS team have eliminated all the delays caused by paper administration. Digitising the process means she could have received a decision on CHC eligibility much sooner, and valuable resources could have been made available for others. Request a demo today to see how the system will help you transform patient flow, vastly improve communication across your stakeholders, increase process efficiency, and help reduce delays in transfers of care for your patients.